Hello, today I'm going to be talking about Tourette syndrome, which is a neurological disorder. It can be broken up into two different categories, which is simple and complex tics, which are repetitive and involuntary movements. So there are two different subsets within the simple and complex tics, and those are motor and vocalization. Some of the most common tics include shoulder shrugging, facial grimaces, shoulder and head movements like jerking, and rapid eye blinking. Simple motor tics are usually repetitive, brief, and very sudden, and they use a smaller amount of muscle groups, whereas complex motor tics usually are coordinated, distinct patterns, and they usually use a multitude of different muscle groups. Vocalizations, which can include like grunting, it can be humming, it can be throat clearing, like very often throat clearing. Sometimes there can be a combination, so it could be like head jerking and eye rolling, or shoulder shrugging, eye rolling, just different things like that, or rapid blinking. It can be a combination of any of them. Tics can actually worsen or become more prevalent when excitement or anxiety is really high. This can affect your child a lot in a classroom. So let's say you're doing an activity and they grow very excited, or they're very anxious for something they have to do or participate in. Their tics can become worse. They can just come on more rapidly, which may kind of seem as a distraction to other kids in the class, but some tips that you can use in your classroom is ignoring it. Like, not exactly like you're just ignoring the child, but ignoring it as if it's normal, like it's the norm, because a lot of the times they can still hear you, they're still aware of things going on in the classroom. It's just something that's a part of their everyday life, and if you keep pausing the class and making it seem like it's a disruption, then that can really affect their anxiety, because they already don't want to disrupt the class. They already don't want everybody looking at them or thinking they're disrupting the class. They want to be a part of the class and not feel like they're outside of it, which they can feel like if so much attention is brought to that. So one way to combat that would be to talk to the class. You can educate them more about it, and that way they can help welcome the student or welcome the child and make them not feel as much of an outsider as having these tics can make them feel. Another strategy that is very useful is having extra time, or like separate classrooms, like study rooms for them to be able to go to. I have a cousin who is in college and she has Tourette syndrome. She usually takes her assessments in another classroom, so that way there are less distractions, and if she needs help, she can get help. Like, some students find that reading and giving the test to the students orally works better if their tics are more prevalent, in the sense that they are continuous and don't allow them to either see for a bit. I know for my cousin, her tic, she goes momentarily blind when it happens because her eyes roll to the back of her head. So sometimes a verbal assessment might be good because she can still speak and everything. It's just she can't actually see, so she can't really write. So yeah, just there's a multitude of different ideas and different tips and different things you can coordinate into your class, but making it known that they are not a disruption and not trying to stop them from doing their tics, because they are involuntary, and sometimes when they try to suppress their tics, it can bring it on stronger. Like having someone be like, hey, can you please stop that, or quiet down, can you stop blinking, can you stop doing this? It's only going to make it so much harder for them. I quickly wanted to reference some of the sites I used when I did my research. I'm going to be looking over here because I have them on a sticky note. I went to Tourette.org, and I used the National Institute of Neurological Disorders and Stroke. So thank you so much for sticking to the end, for listening. I hope this shed some more light on Tourette syndrome for you, and I hope it was informational. Thank you.